Hi, Japhet. This is Sharath from Texila. Thank you so much for coming today. We have a few questions, and I would like to start with something that what motivated you to pursue a PhD in the public health? What were your motivations for this?
Thank you for the question. What actually motivated me is one of my, I'll call him a father.
Okay.
I'm a medic, and one day we were walking in the hospital and he actually asked me a question: how do you connect public health and clinical medicine,
Right.
so that you can better manage your patients? It was a challenging question for me, and from there I developed an interest in public health.
Right.
So that caused me to go into a master's in public health, and after that I decided to pursue a PhD in public health.
Right. And any particular reason that you chose Texila to do your PhD?
Well, one of the reasons is it's an online blended program.
Yeah.
I'm a full-time employee. I'm a family person. That all. I didn't also have the means to leave work, go to school, attend lectures without working. I needed to work and pay. So when I finished my master's, I intended to do the PhD in the same university, but they were not offering a PhD in public health. So when I wanted to do the master's, I'd come across Texila. And I actually would have applied for the master's program, but I changed my mind. Back at home, I come from Cameroon. Back at home, I applied in a university in Cameroon, and it took me a long time to get a reply.
Okay.
So I thought, I heard about Texila, I come across Texila. Let me write to Texila, and immediately, the next day I got a WhatsApp message, I got an email from Texila. The communication was smooth, was running so smoothly, everything was falling in place. I said, okay,
That's basically how it basically came to Texila.
Basically how I came to Texila.
Got it. And if you could think about what crucial research or analytical skills did you develop during this program?
Interestingly, I'm somebody who always loved to do research.
Okay.
But I think at the level of my master's, it wasn't quite developed. In the PhD program, I did learn a lot. I didn't learn a lot, particularly in qualitative research analysis. Particularly in that area.
Okay. And any particular experience that you could think of from academic or research that significantly shaped your public health expertise?
Of course, public health is knowledge acquisition.
Okay.
And when you acquire knowledge, you definitely practice
Right.
medicine very well.
Yeah.
Or no matter what you do, in the field of medicine, public health is really very important, and that has really helped me a lot. That has also broadened my scope in research, and particularly the area where I researched, it gave me an understanding of that area, because something that as undergraduate medical student you didn't do in school, or you just heard about it, you've been seeing such people, such patients. But the area where I carried out my research in disabilities, I learned a lot about disabilities. So, and it's already helping me a lot, and others, particularly in the organization where I work.
Right. And if you could think about the support that you have received from Texila, from faculties or from the supervisors, how has that been helpful for you in your journey?
Yes, like I started from the beginning, my motivation, the enrollment officer was wonderful, Mr. Prasad. I hope I can meet him one day. And my very first mentor, the name has gone off. She too was wonderful. She was always there. Any moment you ask a question, she's ready to reply, or she's ready to give you a response. Even if you say, please wait tomorrow or after some time, but she was ready to give.
Right. Great to hear. And how is this PhD assisting you in your work? I know you have already explained about that. Anything that you could, specifically remember, like as a PhD, like a degree, was that basically helping you in your public health sector?
Like I said, it has broadened my scope a lot.
Right.
Knowledge, my critical thinking has improved.
Okay.
Yeah, my management skills has improved. I'm somebody who is very interested in quality. That has improved, and like I manage a hospital,
Right.
and that has given me a lot of advantage in the work I do.
Right.
Yes, and even in the health system where I work in a confessional health system.
Right.
And the knowledge I've acquired during this period is really helping the organization where I work.
All right. Perfect. And I think that any challenges that you could remember, and how they are resolved.
Definitely, in everything we do, there are usually challenges.
Yeah.
I think I did have a lot of challenges with my studies, and the first one is you are working, like most of my colleagues have mentioned. You are working, you have to blend all
Balance,
this,
yeah.
and you are a leader at your job site. You have to balance all these studies, work, family. You need to move from one place to another, attend meetings here and there. Sometimes even the Eden sessions that we used to be invited on, sometimes we may not be able to meet up with time because work is there for you to do. The other challenge is that as an employee, I had some displacement from my work site.
Yeah.
I remember when I developed my proposal, it was approved. The town where I was working, only for me at the time, I wanted to start. It's not at the time I wanted to start. After finishing developing the proposal, I was approved. I was moved to another town.
Okay.
So that caused me some disorder. Now I have to not like change the proposal completely, but change the title of the research and the town in which it's going to be carried out. So that took me some time. And also had a delay for ethical clearance. It took me about a year before I get my ethical clearance after submitting payment. But I just thank God that at the end I got it, and I also got that from Texila.
And any support that has been given by Texila in order to meeting these challenges, anything that is specifically related to that?
Yeah, not going to the support. I think most of my colleagues have also mentioned the challenges we had with the mentors. Some mentors were so very good, some where I can't understand. Maybe it's an issue of overload of students also. I remember there was a period where I stayed for a month. I didn't get a mentor. There was no mentor I could communicate with.
Right. And finally, what advice would you like to give for the future PhD students in the public health?
Yeah. The first thing I will tell them, public health in general is a very important course for everybody who is working in the health sector to try to pursue.
Right.
Because it broadens your scope and it helps you in your practice. It helps you understand how the health systems work. It
Right.
helps you to be analytical.
Correct.
Your thinking changes
Right.
the moment you enter into public health. But for those who are wishing to pursue a PhD in public health, the first thing I'll tell them is a good thing. I've been there. I understand the challenges. It's hard work, but they should not be frightened.
Right.
At the end, they will definitely reap the fruits of their labor. Yeah.
Wonderful. Thank you so much.